Okay, happy week 13, everybody. I'm just gonna pull up the discussion post right here. Um, I did refilm because I realized I was like staring off into space for like half of it. I felt kind of silly when I rewatched it. So, after watching the TED Talk and reviewing the national drug use statistics, reflect on how stigma affects people struggling with addiction. And how might a social worker balance empathy and accountability when working with clients facing addictions? And what do you think is the most important to keep in mind when advocating for them? So I know that a little bit of the stigma was talked about in our lecture video. And I feel like a lot of people categorize people who, struggle with substance use. You're either like a horrible criminal, you're a horrible parent, you're just an overall bad person. You're a user in a sense that, yes, you use drugs, but they feel like they use other people too. So just definitely like thinking anybody who uses drugs is a bad person is I feel like one of the main stigmas related to drug use. I know a couple different addicts in my life. And my own mother, she doesn't like my friend's mom because of the fact that she struggles with substance use. But I realize, if you spend enough time with a person, you really get to know them. And, you don't think about the substance use. You think about them, you are just an everyday person, you have a laugh, you have a laugh. Yeah. They have a personality, they have a life, they have a family, they have people they are trying to take care of on top of trying to balance all of the negative feelings and emotions they're going through. And then I feel like a lot of people also think they're undeserving, I know, okay, this kind of doesn't really relate in a sense, but like people will talk about, SNAP benefits and people on drugs, they feel like that they don't deserve that and this and that, but, those people are struggling and it's not their fault all the time, and I think just people thinking that they're undeserving of things just because they struggle with substance use is kind of frustrating. I don't really know if anybody else feels that way. I know I feel that way quite often. And then how might a social worker balance empathy and accountability when working with clients facing addiction? So I feel like setting like standards or goals, you hold each other to. So like it doesn't even have to be, we're not going to want them to completely stop drugs because that's going to be a whole other process that they're going to have to go through. But maybe, we can set a goal to start weaning ourselves off of it, start slowly reducing the amount that they're doing, and trying to hold them accountable to that, which it'll be hard, to try and do that. But if you can get like an honest, open relationship with them, I feel like it'll be a little less hard. So setting standards and setting goals and working towards these things, I feel like are a great way to hold accountability on both people, and then empathy, obviously you feel for them, like the whole reason that they're using substances is probably not their fault, they either, grew up in a home that had drugs in it, they grew up with parents who were addicts, and it was all that they've known, and so they didn't like really know what else to do. Just feeling for them, I feel like, well, it's semi an easy thing to do. I know a lot of people, yet again with the stigma, they think drug addicts are bad people, but they're not bad people. My own father was a drug addict for about 8 to 10 years, but he's gotten clean. He's went to rehab and he's doing really good for himself now. So, they can recover, they can get better, they can do everyday normal people things because they are just everyday normal people. They have jobs. Some of them have children that they're taking care of. Yeah. And then what do you think is the most important to keep in mind when advocating for them? So I kind of said it quite a bit, but just keeping in mind that they are just people. They're normal, everyday people who are, they may be struggling a little harder than some people, and drugs are their coping mechanism. And so, we need to advocate and be like, okay, they are just a person, like they need help, like, yeah, I blanked out right there and I lost my whole train of thought. But I mean, yeah, those are my thoughts on this topic. So thank you for watching my discussion post.